Knee joint, femorotibial joint. Fibula doesn't participate in knee joint. Lateral and medial menisci, fibrocartilaginous, they are shock absorbers. Posterior cruciate ligament prevents the femur from sliding anteriorly on tibia, particularly when knee is flexed. Anterior cruciate ligament prevents the femur from sliding posteriorly on tibia, prevents the hyperextension of knee, and limits medial rotation of femur when foot is planted, that is, leg is fixed. Anterior cruciate ligament, posterior cruciate ligament, tibial or medial collateral ligament. They are present on medial side attached to tibia. Sequence of attachment of ligaments on intercondylar ridge on superior aspect of tibia bone from anterior to posterior. Sequence of attachment of ligaments on intercondylar ridge on superior aspect of tibia bone from anterior to posterior. Mnemonic: Medical College, Lucknow. Lucknow Medical College. Medial meniscus, anterior horn, anterior cruciate ligament, lateral menisci, anterior horn. Lateral meniscus, medial meniscus, posterior cruciate ligament. Medical College, Lucknow. Lucknow Medical College. Medial meniscus, anterior cruciate ligament, lateral meniscus, medial meniscus, posterior cruciate ligament. Anterior drawer test. Normally, tibia cannot be pulled anteriorly, prevented by anterior cruciate ligament. In anterior cruciate ligament injury, like in triple triad injury, it can be done. Ask the patient to lie down and do 90 degrees knee flexion. Try to pull the tibia. If tibia can be pulled, then test is positive. Painful test. Knee locking. When foot is fixed on the ground during the last stage of knee extension, femur rotates medially and knee is locked. When foot is fixed on the ground during last stage of knee extension, femur rotates medially and knee is locked. When foot is in air during the last stage of knee extension, tibia rotates laterally and knee is locked. In knee locking, tibial tuberosity goes towards the lateral border of patella. In knee locking, tibial tuberosity goes towards lateral border of patella. Transverse section of leg region, lateral or fibular compartment, aversion of foot at subtalar joint, turns the sole lateral, peroneus longus, peroneus brevis. Posterior flexor compartment for plantar flexion, superficial group, deep group. Anterior extensor compartment, mnemonic: Tom, Dick, Harry. Tibialis anterior, extensor digitorum longus, extensor hallucis longus. Tibialis anterior, extensor digitorum longus, extensor hallucis longus. Posterior compartment muscle, mnemonic: GPS, Tom, Dick, Harry. Gastrocnemius plantaris soleus, gastrocnemius plantaris soleus. Superficial group has common tendon, tendon achilles. Tibialis posterior, flexor digitorum longus, flexor hallucis longer, deep group. Tibialis posterior, flexor digitorum longus, flexor hallucis longus, it is deep group. Dorsiflexion is done by tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. Plantar flexion is done by gastrocnemius plantaris soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus. Muscles of anterior compartment of thigh. Tibialis anterior, extensor digitorum longus, extensor hallucis longus, fibularis or peroneus tertius. It is applied by deep fibular nerve, innervation deep fibular nerve, root value L4, L5. Action: dorsiflexes the foot. All these action is dorsiflexes the foot. Tibialis anterior inverts the foot. Fibularis tertius, aversion of foot. Tibialis anterior inverts the foot. Fibularis tertius, eversion of foot.